Hello, and welcome back to the Transform Wellness Podcast. I'm Dr. Bradford Perkins, and today we're going to talk about one of the most common blood tests that are done on an individual patient called the CBC or complete blood count. So, what is a CBC? This measures your blood's key components like your red blood cells that carries oxygen, your white blood cells, which is your immune system, your hemoglobin and hematocrit, those are related to your red blood cell, and platelets. So we order these tests sometimes just as a general screening or for your physical exam. It also looks for infections, a reason why you're feeling tired, if you have easy bleeding or bruising. We look for chronic inflammation, and it is also used for cancer monitoring in certain people. It also is used to monitor therapies like chemotherapy or other medications. So the key components are the red blood cell, which carries oxygen. Hemoglobin and hematocrit are the oxygen carrying capacity of the red blood cell. MCV, MCH, MCHC, these are always on there. That's what talks about the red blood cell size and color. And then you have your white blood cell and differential, that's your immune status. The differential is the different types of immune cells that you have. And then platelet count and MPV is about clotting and inflammation. So looking at the red blood cell and hemoglobin, hemoglobin is the protein that carries oxygen. Hematocrit is how thick your blood is. So we don't want the blood too thick or too thin. So a lot of times if it's really high on a test, that can be just from dehydration, that can be from sleep apnea, that can be from smoking. Testosterone replacement can also raise the hemoglobin. And if it's low, we think nutritional status, blood loss, or chronic infections and metabolic inflammation. The red blood cell indices, they're called, that's like the color and shape. The MCV, if it's high, we think of B12 or folic acid deficiency or liver issues, alcoholism. Low, we think iron deficiency or a genetic condition called thalassemia, and the rare person, lead poisoning. MCH is similar to MCV, and then the MCHC, if it's low, we think of iron deficiency or thalassemia. It's usually not high, but then we think of another hereditary condition. Now, our white blood cell count, that is going to be elevated with infections, stress, inflammation, and if it's low, that can be bone marrow suppression or viral suppression. The optimal range is 4,000 to 11,000, but a lot of people run lower than 4,000, and those people are probably dealing with something that's suppressing the immune system. So there's 5 types of white blood cells. You have your neutrophils, which is your bacterial defense and inflammation, your lymphocytes are your viral defense and immune memory. Monocytes, we think of chronic inflammation and cleanup. It's also related to gut health. Eosinophils are related to allergies and asthma. If they're also high, rarely that can be due to parasites. And basophils, those go up with an allergic response or histamine. So if someone's basophil count's over 1%, we think of histamine or mast cell activation, things like that. So when a white blood cell count in general is high, we think acute infections, inflammation, it could be from stressors and trauma like surgery, burns, intense exercise can raise it, certain medications. And, from a functional medicine perspective, we think of chronic inflammation, leaky gut, metabolic syndrome and insulin resistance. Is there toxins, chronic inflammatory response syndrome, which is usually related to mold, and then there are more serious causes if we're thinking of, leukemias, myeloproliferative disorders. Those are more like on the tending towards cancer. When the white blood cell count's low, we think of toxins. So that's bone marrow suppression from toxins, nutrient depletion, stealth infections. It can be a chronic viral burden like hepatitis viruses or parvo B19. It can be related to gut immune issues. So that's for something called LPS, that's lipopolysaccharide. Leaky gut can also lead to that. If your immune system's just overtired from fighting mold or chronic infections that can lower your white blood cell count. And there can be hormone imbalances as well, like low thyroid, testosterone. Neutrophils are going to be more specific bacterial, fungal infections if you're immunocompromised. Prednisone is a medication that raises them. Insulin resistance can raise your neutrophils as well. When it's low, we think nutrition deficiencies, we think viral suppression, chemotherapy, certain toxins and heavy metals, or is it something where there's more destruction of the white blood cells from autoimmune conditions or certain drugs? Other causes of low neutrophils can be, again, mold, chronic infections like Lyme and Bartonella. So these are kind of the things I think about when I'm looking at the lab results. High lymphocytes, that's usually acute or chronic viruses. It can be chronic immune activation from autoimmune conditions. Again, those stealth infections can cause it. A lot of crossover between what's, from high and low. You're going to see a lot of things repeat. Low lymphocytes, now I do see that quite often. That can be from chronic stress and high cortisol. Most people around here are really stressed, so I see a lot of high cortisol and cortisol dysregulation. Nutrient deficiencies are also very common. Leaky gut, so it's a gut, brain, immune, all connected. So if the gut's having issues, the immune system's going to be activated or exhausted, then it's going to cause issues in the brain like brain fog, fatigue. It can even lead to mood disorders like depression, anxiety, things like that. Monocytes, we think chronic infections that can be, we don't see TB too often, but perhaps very rarely, but TB is listed there. Fungal infections, usually, mono, I think, which is Epstein-Barr virus, like mononucleosis, that will be high. Autoimmune conditions that can go high as well. Again, that gut-brain immune, that's really what we're focusing on as far as a functional medicine perspective. If it's low, I think micronutrient deficiencies, your cortisol, adrenal insufficiency is down, and are high toxins. High eosinophils, we kind of touched on this, allergies, parasites. You can be seen with autoimmune diseases like eosinophilic esophagitis. So when I'm thinking of food sensitivities, mast cell activation, that's a whole different talk. And again, the abnormal gut microbiome, gut dysbiosis. And then if you have a lot of mold toxins, that can trigger something called Th2 response, which can raise mast cells and then raise your eosinophils. If they're low, that can be from acute stressors. I usually don't see it low, so this isn't very common, but Cushing's can do it. Some sympathetic dominance, so if their nervous system is tending towards fight or flight, suppresses the Th2 response, but usually eosinophils are normal to high. Basophils, these are the ones we don't talk about. It's at the very bottom. It is related to allergies and hypersensitivity reactions. So you think histamine intolerance, MCAS, which is mast cell activation syndrome, mold or environmental toxins that are triggering the mast cells, leaky gut, and there can be hidden infections like H. pylori, candida in the gut. Platelets, this is our clotting. So you should be between 150,000 to 350,000. If it's too low, it's a bleeding risk. Too high, it's a clotting risk. MPV is the mean platelet volume. So they're talking about the volume of the platelet cell. Should be between 7.5 to 10.5. So if it's getting high, 12, 12.5, 13, then you think metabolic inflammation. And, I have a whole other talk on that. If it's low, that's usually related to aplastic anemia or chemotherapy. So it's not usually the case. High platelets can be reactive or secondary from chronic inflammation, iron deficiency, certain infections, if you've had your spleen removed. But from a functional medicine perspective, I think insulin resistance and metabolic syndrome, again, leaky gut and chronic toxins. So you think gut, brain, immune. That's what I just think through all these labs is, if these are abnormal, I'm thinking what's going on in the gut, what's going on in the immune system. Low platelets, this does happen as well. It can be decreased production from nutrients, chronic viruses. You can have chemotherapy and toxins. You can have things that increase the destruction of the platelets. So that's a condition called ITP, certain autoimmune conditions, certain drugs can do it. And then from a functional medicine, I think mycotoxins, I think chronic infections like Lyme and Bartonella, and then mold-related SIRS, which is chronic inflammatory response syndrome again. MPV, we talked about, it is, if it's over 10.5 to 11.5, you're thinking metabolic syndrome, insulin resistance, obesity, increased risk of cardiovascular disease. And just think MPV is a marker of metabolic inflammation and endothelial health, so the health of your arteries. CBC patterns. So if I see a high white blood cell count, high neutrophils, in a normal hemoglobin, platelets can be high or low depending. This is what more an infection would look like. And the MPV is usually normal to slightly high. If it's chronic inflammation, I'm looking at white blood cell count slightly high or normal. Monocytes and basophils are going to be elevated. Your hemoglobin may be mildly decreased. Platelets might be slightly high, but the MPV is high. So I'm looking at the monocytes, basophils, and MPV for chronic inflammation. Cancer, that can be all over the place. The white blood cell can be very high. I mean, we're talking 80,000. Differential can be wide variety, but the hemoglobin is usually low and platelets are low. And then, so key takeaways is that the CBC is a quick window into our oxygen delivery status, our immune health, how we're clotting, and metabolic inflammation. And then we always need to think about the lab result in the context of why someone's coming in. Are they coming in with an acute infection? Are they coming in because they're tired and fatigued? Or we're just doing it for screening purposes. So thank you for your time. I hope you enjoyed this talk. Please subscribe to my channel for weekly health videos. And if you have any questions or comments, drop them down below. And I hope everyone has a great day.